All right, we are at the top of the hour. Hi, everyone. My name is Melina Allums. I'm the program coordinator here at NCHL. Really excited to be hosting this webinar for everybody. And I am quickly going to say we are really excited to always have Aon on our side, on our team. And we're excited to throw this over to them. If you have any questions, you can always throw them into the chat. Throughout, most of the questions will be answered at the end of this webinar. So just be a little bit patient, but I will throw it over to the team at Aon.
Hi, everyone. Um, Excited to share some results from Aon's benefit survey of hospitals. You're getting a first look preliminarily on our report. It's going to be released to participating hospitals next week, but we're excited to kick it off today. All right, so let's make sure everything shares and we'll get started. And like Malia said, just send us questions through the chat. We're happy to answer whenever it makes sense. If we're going over the content, we'll integrate our responses. Otherwise, we'll definitely get to it at the end. All right, with that, I'll do a quick introduction and then hand it off to Frank. I'm Sheena Singh. I'm a Senior Vice President in our healthcare industry practice at Aon, focusing on the health solutions or health and benefits space. Frank?
Good afternoon, everyone. Frank Lonardo, I lead Aon's healthcare industry vertical for our health solutions practice. Forward to the discussion today. We just wanted to spend a moment on our healthcare industry practice. So our practice, our healthcare practice goes across everything we do from a human capital and risk capital perspective, and it's dealing with the unique perspective of you being both an employer and a provider, and the intersection of those. As a practice, we look across to provide information and innovation and solutions specifically tailored, to the industry. As we go through the survey today, you'll see an example of that. If we go to the next slide. So our hospital benefit survey of hospital is now in its 19th year. For this year, we have 157 health systems representing over 1,500 hospitals and 3.3 million employees. So as we look at these organizations across the country, representing representing the largest health system in the country, academic medical centers, community hospitals, and specialty hospitals. We're going to be touching on just some components of it today. It's over 80 pages of information, providing broad perspective on not only benefit trends, but what are the leading things from an attraction and retention standpoint, as well as you'll hear us talk about things in terms of cost management and things as we look at not only what's happening today, but looking things that groups are considering just beyond and things beyond that horizon, addressing the complex world you all live in. So as we think about our hospital clients and broadly our healthcare clients, we see six things that as people are planning for next year and beyond, really driving a lot of how groups are thinking about their total rewards planning. So all these topics Sheena and I will touch upon today, but looking at attraction and retention as we go through the statistics today, ever evolving. We did see some slowdown in turnover. However, it still is top of mind for all of our organizations, how they're reacting and how they continually change the total rewards framework, especially in the last 5 years. We have groups looking at understanding what employees value. There has been rapid change in the last few years. Groups now are stepping back and looking at and really garnering the opinion of their employees to try to determine, as trade-offs exist, what are the types of things that drive employees to come to the organization or to stay at the organization. The backdrop of that is cost containment For the last 2 years, we've really seen cost go up significantly. And unfortunately, in the next 5 years, we continue to have that expectation. So groups really looking at, high cost claimant strategies, trends such as GLP-1s, which I'll dive into. How do you balance that out as it relates to the entire rewards package? Optimizing benefit offerings, as the backdrop of being competitive and the cost implications, really trying to balance that with employee affordability. And looking ahead, saying, as I look at all the various segments that I have within the health system, the look towards and starting of things such as differentiated benefits, as well as really pressures on time off and other things that have been driven as they're looking to optimize that portfolio of benefits. Sheena will touch upon burnout and workforce resiliency. As an example, mental health access is still the number one top concern as it relates to HR executives who answered the survey. And last, managing fiduciary obligations across the industry in the wake of Wells Fargo and Johnson & Johnson about the fiduciary responsibility to plan. We see this as very top of mind in terms of our HR executives and benefit executives in terms of managing the fiduciary obligation of the plan. A unique set of circumstances as it relates to when you're both not only the plan sponsor and a provider, and some of you as the insurer as well. So as we talked about the rising cost, as we look at total rewards in the next 5 years, the expectations. So from 2025 to 2030, it's expected that total rewards, the complete package, will increase by 21%. A big part of that increase is the healthcare component. So many groups are looking at how could that be managed more effectively, since wages remain such a critical component and the number one component in terms of attraction and retention. What are some of the techniques to balance that? As you can see, not only is the pie increasing, but the percentage related to benefits is increasing, and a disproportionate of that is related to healthcare.
All right. Thanks, Frank, for the review of sort of the key trends that are impacting our health system as it relates to their total rewards and benefits. So starting off with the first question we always ask health systems in our benefit survey is, what's top of mind for you in terms of areas of focus and priorities? What we typically do is we get them to rate all of these segments here in terms of priority. And as Frank mentioned, the number one concern continues to be access to mental health services and providers. So that was the number one concern in the 2023 survey. It continues to be a focus and area of priority for health system employers in 2024. The other areas, we're really focusing on the top 10 for today's discussion that groups are thinking about. No surprise, per Frank's introduction earlier, the increasing costs for the health systems and the concern around containing those costs is, again, top of mind for health systems, and that moved up in priority from 2023 to 2024. But equally as important is the concern and the need to provide a competitive total rewards package to attract and retain talent. So if you look at the percentage of groups that are focused on the rising cost of healthcare and focused on competitive total rewards, they're exactly equal. So those are, super important things that health systems have to think about balancing to provide that value to employees and continue to support them while finding ways to manage or mitigate costs that are impacting their ability to provide benefits and total rewards that are really critical to their talent and their the well-being of their employees. The other thing that I think is important to note is that just as importantly, health systems are also focused on the increasing cost for employees as it relates to healthcare. So affordability is still top of mind for health system employers, and making sure that their employees are able to afford, the cost share from a health plan perspective, whether that's your deductibles, copays, coinsurance, but also in terms of removing or limiting barriers to accessing care when it comes to those costs, especially for the lower wage earners. So we're going to talk a little bit about different approaches that health systems have looked at or are contemplating putting in to further help support low wage earners who are more vulnerable in terms of having those financial barriers that can mitigate better outcomes and an improved experience around healthcare. The one area that moved up significantly from 2023 to 2024, 12 spots in ranking, as Frank mentioned, is the need to manage fiduciary obligations and risks as a plan sponsor, all of the obligations that as self-insured employers that ERISA dictates, and making sure that you're addressing the obligations around looking at how healthcare services are priced. You're selecting your vendor partners and the pricing of those vendor partners, and really having a good fiduciary process in terms of documenting the decisions you make for the health plan. That is critical and top of mind for health systems with all of those lawsuits that Frank mentioned have come up. And then last, retaining services within the domestic network. That continues to be a focus and strategy for those health systems that can provide services to their own employees. And we'll talk more today as well about different strategies that health systems have to steer services back to their own delivery system, as well as then address the other side of that, which is access to those services and making sure the access is sufficient for employees and their dependents to be able to see the providers with their own delivery system. I'm going to shift a little bit and talk about perceptions that health system employers have of their own benefits, of their well-being programs, of their total rewards package. So these are statements that health systems rated themselves on in terms of how much they agreed with the statement or potentially did not. And so what I love to see when we ask this every year is just, sort of the perception of the employer around their total rewards package in particular. So you can see that, 77% of health systems feel that their total rewards package meets their employees' needs, and 74% feel that it's competitive for attracting and retaining talent. I always like to jump to the bottom of this chart and show that while that's true, a great percentage feel that it's a sufficient package. Only 25% of healthcare organizations feel that their employees fully understand what their total rewards package is at their organization. So there's a lot of opportunity here to close that gap between offering a great total rewards package and then actually ensuring that employees understand that and then optimize all of the availability of resources that are provided in that total rewards package, whether it's benefits, time off, and then of course compensation and other benefits as well. So that is definitely, an area of focus for health systems, is how to close that gap to make sure that they're optimizing their dollars that they're investing in total rewards, and that it's meeting more in the middle in terms of the value that's available to employees. The other area that, we wanted to point out here was that there's a lot of focus on well-being. In our survey, about 93% of health systems have a well-being program or offer some, well-being resources where they feel like they've formalized an offering. However, only 51% of organizations say that their well-being initiatives are effective. So that's another area of opportunity. the Aon team is actually going to be at the national conference in November, and we'll be presenting on well-being strategies for health systems. So that'll be an area to talk more about, what steps health systems can take to maybe make that, even the value of that well-being program, more effective for their employee population. We asked health systems to rate their own, approaches around the strategies to attract and retain talent and what was most effective to attract and retain talent. So no surprise to most on this call that compensation is the top lever that health systems believe is effective in attracting and retaining talent. But some of the shifts that we saw this year versus 2023 was health and ancillary benefits moved up 2 spaces in ranking here. So it was number 4 in the prior year. One-time compensation and flexibility in terms of remote and hybrid working and scheduling, those were 2nd and 3rd in 2023, and they've moved down a little bit, where benefits has kind of come back up in terms of priority and importance around, being effective in attracting, and particularly, I would say, retaining talent to keep people within your organization as well. Not that, the one-time compensation and flexibility aren't still critical, but I think there's also more expectations that are set, especially around flexibility, in terms of expecting that there's those opportunities, particularly for the non-clinical workforce as well. In terms of how health systems are kind of doing a temperature check on what's happening from an employee perception perspective around their total awards and experience around their benefits, there's a lot of different types of approaches that health systems are taking around employee listening. That could be in the form of short or long surveys that are available, lots of pulse surveys that are coming up more and more that, I would say 5 years ago, health systems were nervous about asking anything around perception and, having that fear of, okay, well, if we can't follow through on fixing something, should we even be asking? But I think those types of surveys are really helping health systems think about, again, how do we optimize our offering so that we are not investing in programs that are not valued by our employees, and we are investing more in programs that are valued by our employees. So one of those approaches around surveys that addresses that, for example, is doing like a conjoint or trade-off analysis. So survey testing those employee preferences is something that we are seeing more and more focus around. So 16% of organizations have done those types of conjoint analyses and surveys. Another 31% are considering doing more of that type of focus. And then, of course, as HR leaders know, communicating about benefits and key messages is a year-round strategy. So how you communicate that and the channels that you use are really critical and important. So, we also asked health systems to tell us what strategies they have in place already to do that and what they're considering. So, like, for example, 54% have total award statements, but another 33% are looking at having a more formal total award statement to lay out and explain the value, the financial value, especially of the benefits and wages that they offer to that employee. And then some of the other, things that we see that groups are doing is having champion networks to sort of be those conduits to share information about all the great resources that you have, and even navigators or advocacy representatives that can sort of reinforce all of the value that you bring to the table with your multiple programs. In terms of workforce strategy and changes that we saw health systems say that they were making, focusing here in particular on the ones that I like to look at are where groups are considering investing more resources. So for example, 47% of health systems have improved their platform for employees to share feedback, but another 24% are considering this. Another example being offering a formal career mentorship program. While only 30% may have it in place today, another 27% are considering it, and even providing those career journey mapping opportunities to really think about the long-term vision of what an employee can achieve within the organization. That really adds that value to retention in particular. So I love to see that there's a lot more focus on that career well-being and making sure that there is an opportunity for groups to feel like they can stay within an organization and not have to jump from one to another in order to get the value they need to continue to grow with the organization and the benefits and support around well-being that they're provided. One thing, that I think is no surprise here, offering more hybrid working options that, is now a mainstay in terms of the ability to work virtually or in the office, particularly again for the non-clinical staff, although we do see more of that type of flexibility being considered for the clinical staff as well. For example, there's an increase in hiring full-time clinical remote workers, 22% implemented strategies around this, another 26% are considering it. In terms of benefits that groups are offering and modifying, voluntary benefits, tuition reimbursement, financial well-being, those are all, types of programs and benefits that we have seen in place, for a long time and continue to be reviewed in terms of making adjustments and modifications, whether it's the type of benefit you offer or the investment you're making in terms of the reimbursement. So those we always see at the top. Some of the areas that I wanted to point out, again, I think important to focus on where groups are considering making changes. So as an example, enhancing the EAP model, the mental health provider network, and replacing that traditional employee assistance program. 32% have this in place. Another 28% are considering making changes there. Student loan restructuring or repayment programs, 36% made changes in the last 12 months. Another 31% are considering making changes to their offering there. One of the things, another thing is expanded fertility coverage beyond the health plan and the medical plan. That's an area of focus too. We have a deeper dive in our survey around family building benefits and what groups are doing there. And then when we go towards the bottom, in the last couple of years, we heard a lot about flexibility and adaptive benefits and trying to give employees choice in terms of their benefits and what they can spend their dollars on. So we hear a lot about lifestyle spending accounts as an example. Well, you can see here, only 6% of organizations are offering those lifestyle spending accounts today, but another 31% are considering. So this continues to be something that's contemplated or considered by healthcare organizations, but still low prevalence. Around diversity, equity, inclusion, and belonging, there's definitely a lot of different approaches that groups are taking to address this, whether it's from a more inclusive work environment, looking at pay equity, looking at, just really having a more formalized statement or mission around DEIB and communicating those commitments. And some of the areas where there's some, higher consideration to address DEIB, for example, is addressing social determinants of health. 45% are actively doing something around this from the, HR lens, and another 30% are considering doing more around addressing social determinants of health. Additionally, creating outside apprentice or mentorship programs, 36% are offering today, and another 28% are considering. And last, modifying benefits to address equity, inclusivity of the diverse workforce. That's definitely also an area of focus, is looking at benefits to ensure that they are meeting the organization's DEIB objectives and are in line with those DEIB objectives. So benefits can be a reflection of whether or not you're living up to the statement you make around DEIB and what you're offering to your different diverse populations. And emotional well-being, we talked a little bit about this earlier in terms of like top of mind, what, groups are focused on, especially with mental health access. I would say, the top approaches are still offering, emotional well-being resources, providing manager and training support, and then, really looking at approaches to enhancing the employee assistance program, whether that's expanding the network, looking at some of those broader vendors out there that expand the network and provide virtual access, like Alira or Spring Health, or even just adding more EAP sessions to make available to employees. And in that same guise, we also, ask health systems to tell us what they're doing to address burnout, which again, kind of go hand in hand with emotional well-being. Some of the things that I think are, important to point out here are, manager trainings to really make sure they're set up to talk to employees about all the resources that are available to them, or to identify potential, symptoms of burnout, and make sure that there's opportunities to guide people to the right resources. Same with peer-to-peer support programs to do a similar thing there. But then, burnout can be driven by other things like administrative burden. So looking at things like improving the workflow efficiency and staffing is really critical to addressing burnout as well. One of the areas that I think is interesting, only 17% of health systems are measuring burnout and including CEO accountability to that today, but another 39% are considering. So that's an area of interest for us to continue to look at. All right, Frank, I'll hand it to you.
Thanks, Sheena. So it takes some elements of benefits and things that tie into those 6 areas where groups are focusing. So the one area that for the last several years, supporting low wage earners, and 2 things at play. It's not only the increasing cost of healthcare, it also relates back to general inflation, general affordability. People are strained. Large segment of the workforce are strained. If you look at just nationally, and specifically as you bring this to your own employee population. But some of the strategies groups are employing, lower employee contributions based on salary. We're now at 50%. A few years ago, this was much lower. A lot of reasons driving that. As a percentage of someone's paycheck, someone at $40,000 paying a premium is very different than someone making $250,000. Also, the nature of pre-tax. Someone at that $200,000 level. A good portion of that will be very powerful to them as a pre-tax benefit, meaning they're in the 30% tax bracket, so they get a break on their premium. Whereas the employee at the other end of the spectrum, many of your employees are at the 0% tax bracket or near zero, based on their wages, their family status, et cetera. So we continue to see an acceleration here. And then, how do you, beyond that, what are specific type programs, employee-only financial needs, looking at total out-of-pocket, both the members out-of-pocket, what they pay for the program, and maybe basing it on, percentage of poverty level to create a customized program, as well as looking at the types of things embedded in your health plan. So things such as if you have an HSA or HRA contribution, doing salary banding. So the contribution for the HSA would be, higher for a low wage and lower for a higher wage. So only an 8% adoption, but with 16%, considering. And then embedding into the program, there are groups right now that have lower out-of-pocket expenses, lower copays. They literally set up a parallel plan for their lower wage earners with lower out-of-pocket expenses in a couple of different ways that they get there. In addition, as we reflect on the fiduciary aspects of the plan and how that really is top of mind, in the middle, you'll see custom fee schedule for domestic. We're not going into it here, but one of the questions we dive into in the full survey is, how do people pay themselves? So if you look at Johnson & Johnson and Wells Fargo, was surrounding that the plan was not diligent in terms of how they were managing the employee, the member and the plan's expenses. Well, health systems are a very, unique situation where not, good part of the utilization, generally 2/3, is within your own health system. So when employees pay out of pocket or pay a percentage of the premium through deductions, so custom fee schedules, we've now eclipsed, we're at 50% of the groups have a custom fee schedule, something lower than, and this is really being addressed by their fiduciary committee. How they arrive at, what to pay lower is a variety of different ways. But this continues to accelerate. Some build it right into their how they're supporting low wage earners, but overall, again, 50% as they're looking at what should we be charging ourselves and what would it be from the right prudent, from a prudent fiduciary perspective. Next page. So keying in on one of the biggest, one of the most volatile areas that we've seen, GLP-1 coverage, specifically for weight loss. We've seen groups where by far the largest cost increases that they're seeing is on the GLP-1 weight loss drugs. We're now up to 46% of the groups are not covering weight loss coverage, and 54% are still providing coverage. Of that 54%, on the right shows what are the types of things that either they have in place or considering putting in place, including groups looking, additional groups looking to potentially eliminate coverage. And we know going into 25, different health systems, again, continuing to explore that. Literally, the weight loss drugs almost crowding out every other type of expense. So groups are looking at different types of increasing the program requirements to try to really focus the benefits of these very powerful drugs, but focus them in a way where it's on the percentage of the population where the plan and the member will see the most benefit. So there's a lot of groups considering this. The reason why the adoption rate's not higher, the drug manufacturers, along with the PBMs administering the rebates, are really putting a lot of restrictions around. If you go beyond the FDA indications, in many cases the rebates will be taken away or greatly reduced. Rebates for this class of drugs represents about 40%. So if you have a $10,000 expense, they're filling in $4,000. So the rebates, the loss of rebates, or the full loss of rebates makes it very, very difficult. So that's why you see such a dichotomy between some of these other ways that they're trying to manage it and people considering as they're really trying to get better clarification working with the PBMs. The last thing I would say is we have had groups utilize their internal pharmacy saying, we're going to forego the rebates. We're going to use internal pharmacy. We're going to use 340B pricing. We're going to use some of our internal programs to really manage this in a different way, really manage it and focus it to the participants that this would really be the most beneficial, but economically the plan can afford it. Next slide. All right, so domestic utilization, continues to be one of the most effective ways that you think to manage the plan. As Sheena went through the top things that people are considering, this is still over 80% of the groups are looking towards this as a strategy. What we're seeing a shift in, so 88% of the groups, no surprise, lower the cost for their own domestic facilities or providers. Overwhelmingly, really the group that makes up the 12%, many of that, we have, groups that participating in specialty hospitals like specialty cancer or pediatric hospitals as an example. But we do see the continued adoption of other types of strategies and programs. Example number 3, excluding certain providers from the network, 36% excluding, not offering in that tier 2 every provider. Groups looking at this from a cost and quality perspective with another 10%. So that continues to be an adoption. And then other types of programs that's not just punitive on, hey, if you go outside the network, it's going to be a much higher cost, requiring a first or second opinion for a domestic COE, so almost like a required stop. We've seen this, say, in musculoskeletal, where, hey, for knees and hips and shoulders, we have a required stop, almost structuring it as the concierge program. They're allowed to, after having that consultation, and the goal is really to try to, key into the fact that most patients, the first stop they go to is where they receive their care. And again, it can be, high in terms of satisfaction because, again, you're taking out for your non-clinical staff some of the guesswork that's involved with that. So just another take on that. The flip side, as we think about employee satisfaction and the fiduciary response, the fiduciary aspect is, what are the types of things no domestic network generally can handle? All the services, all the access, all the geography. So things such as supplementing telehealth, identifying non-affiliated providers, some of those tier 2 providers, and put them into tier 1. Over 50% of the groups are supplementing their own network. Behavioral health will be one. Probably 80% of the groups are supplementing behavioral health. Pediatrics would be another. But then again, and then going out to the business, to your physician network, your ACO, saying, hey, we need to do something better on access. So things such as extended hours for your employees, setting up near-site on-site clinics, reserving open slots so the employees have ability to access. We have groups now auditing. You're doing secret shopper audits. We've had several groups do it, where they're actually calling out to providers to demonstrate if there's, really closed practices or wait times that are unacceptable from the employee perspective. So a lot of things happening in that space, because access is probably the universal thing we hear from our health systems as it relates to utilizing their plan. Last, we're just going to spend a moment on differentiated benefits. So the first section here, the executives and physicians, this is well worn, almost 3/4 of executives and 2/3 of physicians, where meeting the unique types of benefits, a lot of this is driven by the fact that, traditional benefit programs based on coverage limits for retirement or other components based on long-term disability just don't meet the requirements. So no surprise in terms of like specific things being done. Example on PTO would be unlimited for executives. Physicians would be individual disability insurance, making sure they're covering for the specialties. Residents, a lot of it driven by the program specific, to residents that you need to meet. So there we see significant amount. If we go to the next section, so some of the things that we see emerging. So on our top concerns, it only comes up as 25%, considering it's a top concern. So we have seen movement, advanced practice providers, where they are taking a increasingly bigger role in the primary care. So matching those benefits up. Nursing, with the shortages and other things, like people building programs and other things surrounding, we have several groups we work with where, the later stage, long tenured service, like trying to keep them on longer for training purposes and others, and doing things different with their medical benefits. The other side, the service employees, only 7%. I can tell you that I presented at a CFO conference about 8 months ago about employee benefits in hospitals. The single biggest thing that was on their mind is they cannot continue as they expand in the subacute hospice, home care, freestanding, to offer the same benefits. Average cost of family health insurance is $26,000. If you have a caregiver at $40,000, it's hard to reconcile. So different types of programs, even though it's only 7%, we expect this will change. The financial pressures, as more of your delivery system is in those subacute areas that have very, very different reimbursements.
All right. So like we mentioned, this is just a snapshot of our benefits survey of hospitals, which is, over 80 pages long. So there's a lot more that we could get into, and a lot of details around some of the designs related to some of the findings that we have in our survey. So hopefully this at least gives you some perspective on where health systems are going in terms of their overall total rewards and benefits strategy and what they're thinking about and what's top of mind. We gave you a preview of this survey. It'll be released to our hospital participants next week. It's a free survey to participate in to get access to the report. So as long as you participate and share data, you can get that full report. So we encourage you, if your organization, your benefits and HR team is not participating today in the benefits survey, we welcome participation for next year. You can always reach out to Frank or myself if you have any questions from our review of this, or if you want to do a deeper dive into a particular area of focus that we gave you some perspective on today, just reach out to us. And I believe you'll also get recording of this webinar too to have to access later. So Malia, I will hand it back to you and also see if anyone has any questions, if we have a few minutes left.
Yeah, absolutely. If there are any questions, you're welcome to drop them in the chat, and I'm sure Frank and Sheena will have some great answers for you.
If not, you know where to find us now.
Absolutely. And again, as mentioned, the Aon team will be at our conference in Chicago in just a couple weeks, talking about well-being. So if you are registered, we're really excited to see y'all there.
Well, thank you, everyone.
All right,
Good
thank you all.
Yeah, thank you for your time.
Thank you.